Assalamu alaikum, welcome back to Dr. Teeth. In this video, we are going to talk about all metal crowns, its advantages, disadvantages, indications, contraindications. Now today in dentistry, we have a lot of material option available. They have different levels of strength and aesthetics. So we will see in this video in which cases can we use an all metal crown and where we should not use such type of crown. So let's get started, and if you are new to this channel, please consider subscribing, and if you like this video, please give a thumbs up because it really motivates me to create more videos of this kind. We will begin with advantages. An all metal crown is very strong. It is one of the strongest materials available. It requires less tooth preparation. Now since it is very strong, even in less thickness, we can get that strength, okay? So because of this, it requires less tooth preparation. We only have to cut the tooth around 1 to 1.5 mm. If made from base metal, it is very affordable. And if it is made from noble metals, it is extremely biocompatible. It is very easy to fabricate, and also if it is made of gold, it is very easy to burnish the margins. So we get a proper seal. So there won't be chances of secondary caries. And it can also be made via CAD/CAM technique. So with this technique, we can easily get a very accurate crown. Also, in case we want to retrieve it in the near future, it can be easily retrieved. Then let's talk about disadvantages. The major disadvantage is obviously its unaesthetic look, okay? We cannot give it for the anteriors. It can't be modified. Let us suppose this is our all metal crown and here we have our natural teeth. So if we have a proximal gap here, it's not possible to modify this. Also, if we over trim it, it is not possible to add up more material. That is a disadvantage. Also, it is difficult to check the occlusal interferences because the articulating paper does not mark well on the surface of metal. Now let us see where is it indicated. So it is suitable for posterior teeth. We can give a crown or a bridge or an inlay and onlay. It is also suitable for patients with parafunctional habits like bruxism. Also indicated for the teeth having a short clinical crown height. Okay. So if we have a teeth, let us suppose this is our teeth and we have a short clinical crown height. So in such a case, if we are choosing, let us suppose a PFM crown, we have to do a lot of tooth preparation. So if we do a lot of tooth preparation for a PFM crown, obviously the resistance and retention form will be compromised. Okay. So in those cases, if we go for an all metal crown, we have to do less amount of tooth preparation, right? So when we have to do a less amount of tooth preparation, obviously the resistance and retention form will not be compromised. Okay. So it is indicated for teeth having a short clinical crown height. Also, if we have less occlusal clearance, an all metal is indicated. Coming to contraindications. In aesthetic zone, obviously it cannot be given. If the patient has metal allergy, we cannot go for all metal. Also in cases where we cannot get a proper retention or resistance form, we cannot give an all metal. So I hope you found this short video helpful. In the next video, we'll be talking about the PFM crowns. Let me know in the comment section below if you have any questions or comments. I'll see you in the next video. Take care. Allah Hafiz.